Thank you for tuning in. I am Janelle Hom, the Executive Director of your local American Lung Association here in Central Florida. November is Lung Cancer Awareness Month, and this is the third year now that the American Lung Association has released the State of Lung Cancer Report. Lung cancer is the nation's leading cause of cancer deaths, and it's estimated that over 18,000 Florida residents will be diagnosed with this disease in 2020 alone. The 2020 State of Lung Cancer Report from the American Lung Association finds that while more Americans are surviving the disease, people of color are facing poorer health outcomes than white residents, and Florida can do more to improve access to lung cancer screening and treatment for this disease. The third annual State of Lung Cancer Report examines the toll of cancer throughout the nation and outlines steps every state can take to protect its residents from lung cancer. And for the first time, this year's report explores the lung cancer burden among racial and ethnic groups at a national and state levels. We're going to be talking about some of the elements around the state of lung cancer, which include incidence rates, survival rates, early diagnosis, surgical treatment, lack of treatment, screening and prevention, and health disparities. If you'd like to read more about the state of lung cancer, you can visit lung.org/SOLC. And if you want to get more involved with the American Lung Association in our efforts around the state of lung cancer, feel free to reach out to us locally. We serve 10 counties here in Central Florida. Today, I'm really excited to have one of our friends from Orlando Health with us, Dr. Matthew Johnston. So good morning, Dr. Johnston.
Good morning. It's a pleasure to be here.
So I'm going to give our viewers a little bit of background on you. So Dr. Johnston is a fellowship-trained thoracic surgeon with Orlando Health's UF Health Cancer Center. He is certified in laparoscopic surgery by the Society of American Gastrointestinal and Endoscopic Surgeons. After graduating magna cum laude with a bachelor's degree in chemistry from the University of South Florida, Dr. Johnston earned his medical degree from the Florida State University College of Medicine in Tallahassee. He went on to complete a general surgery residency with a thoracic surgery fellowship at Wake Forest Baptist Medical Center, where he has served as an instructor in thoracic surgery. Dr. Johnston was an inaugural member of the Collaborative Quality Advisory Council at Orlando Health and is a third-generation thoracic surgeon. He's been published in American Surgery and has presented at his studies at annual medical conferences. He's also a member of the American College of Surgeons, the Golden Key International Honor Society. Wow, you are very accomplished, and we are just so honored to have you with us today and be able to pick your brain a little bit about the state of lung cancer here in Central Florida and for the state. So let's dive into it. So we talked a little bit about how the state of lung cancer looks at things like early detection of lung cancer, survival rates, and early interventions. So maybe we can start this off for our audience and to be able to just, if you can talk with us about lung cancer and why early detection is so important.
Well, I mean, that's great information. I think the biggest thing when we talk about lung cancer is, we look at survival rates. The overall survival rate is actually fairly low. I mean, you look at cancer among Americans in general, lung cancer is the number 2 cancer found in men and women, but it's the number 1 cancer killer because it actually, is found oftentimes at a later stage when we look at the time of diagnosis. And, that's kind of one of the biggest impacts we try to have on lung cancer awareness, lung cancer treatment, and screening, really. And that's, the area that we, have found recently and want to really emphasize and look at to try and find this at an earlier rate. The issue with lung cancer is oftentimes patients can have this and never know it because it doesn't cause that many symptoms, and so it can grow in the lung without anyone even being aware of it. As opposed to breast cancer, where sometimes often you can find a lump or you can notice something physically. The lung cancer grows inside the lung without any feeling. It doesn't cause pain. Sometimes you can have a cough, but oftentimes people with lung cancer are often smokers and they have a cough anyway, so that's not new. And so the rate of detection is really the biggest hurdle that we have, because even today, the majority of patients that are diagnosed with lung cancer are diagnosed at an advanced stage where the treatment options may be limited, or the cure rate, as the stage gets higher, the cure rate decreases. So that's, I think, one of the biggest issues with lung cancer that we find. The majority, even today, that we see that are surgically treatable are often fine incidentally for other reasons. A patient had pain for something else and they got a CT scan at the emergency department and it found a spot. Or sometimes we see people that are in a car accident or have some kind of trauma and they're worked up for that and incidentally find a spot in their lung. And so it's great when we have that, but obviously we want to try and focus that we can detect this earlier and stop it earlier, and have some options for treatment.
Absolutely. And I think something that might be worth chatting about kind of quickly with this too is when we talk about early detection and the need for screening at an early stage. The American Lung Association about 3 years ago launched a campaign called Save by the Scan to help to educate the general public on who is actually eligible to be screened for lung cancer. Right. And of course, that's always advancing every day, but can you talk a little bit about what those screening parameters are for our audience?
Of course. The main focus for lung cancer screening was actually based on a trial called the National Lung Screening Trial, and that looked at patients that had basically fit in a certain age range, 55 to 75, and they had either current smoking history or had quit within 15 years and had a total of 30 pack year history of smoking. And when we talk about pack years, basically what that means is it's if you smoked 1 pack of cigarettes per day for 30 years or an equivalent of that, whether it's 2 packs for 15 years or something of the same measurement. And those are really the patients that fit into the group that we consider high risk. And those were the main patients that were looked at in the trial. And the trial actually compared doing a low dose CT scan, which is basically a CT with less radiation than a normal CT, compared to a chest X-ray for trying to find lung cancer. And it was done over a course of 3 years, where they would either have the CT 3 times once a year or the X-ray. And what the study found was that the patients that had the CT scan had a 20% lower risk of dying from lung cancer than those that had chest X-rays. So the original screening tool was a chest X-ray, but we know that the ability to find a lung nodule in a chest X-ray is much less than you have limited resolution. You're looking at different things. CT is much more detailed at looking at the lungs and really 3 dimensions overall when you look at it, and that gives you much greater information and allows us to detect nodules at an earlier rate of smaller size. And so those are the patients that the guidelines suggest now that are considered high risk, but really could benefit from lung cancer screening using a low dose CT. So it's those patients age 55 to 74, current smokers or has smoked within the last 15 years, and have a 30-pack year history of smoking overall. And so that's really the big step for screening, and that's one of the things. Obviously, screening itself, everybody that gets screened is not necessarily going to have lung cancer, of course, and everybody gets screened also. Oftentimes we can find a lung nodule that may or may not be cancer, and it may require further workup. But there are also other things that can be found on the screening too. And I think that's the biggest thing that we struggle with. And I think some of your state of the lung cancer reports have revealed, especially in Florida, our rates of lung cancer screening are lower, below average nationally. And that we've been trying to focus on. We have a lung cancer screening program at Orlando Health, and we try and focus on that frequently. Finding out what can we do to get more patients involved in that, because we know that those patients exist in our community, and that's what we want to try and capture, to find those patients early so we can offer treatment. We can get them through, cure them, because obviously find these patients early, cure them so they don't have to live with this or die from this. And so that's one of the areas that we are definitely focusing on. And I think this platform obviously is a good to expose patients to this and to bring awareness to the issue we're having. And one of the great things about having this opportunity, talking with you and being able to discuss this and get this out, for the awareness for patients.
Absolutely. It's all about collaboration for us to be able to help solve this problem here in Central Florida. And thank you for the great work that you all are doing as well to help screen these individuals. So something that was really interesting in this report was looking at the 5-year survival rate. And nationally, that number is starting to get a little bit better. And that's good news. We certainly have a ways to go. But we'd love to hear from your perspective. What do you think are some of the factors behind seeing these improvements in the 5-year lung cancer survival rate?
So I think that screening has a lot to do with it. Like I said, finding these cancers earlier is the biggest step to improving survival, decreasing the death rate from lung cancer. And, that is the biggest that we have. We want to, like we said, find this early so we can treat it. We know for facts that, obviously, like I said earlier, the earlier you find this, the higher your chance of curing and the higher your survival rate is for lung cancer. And so, knowing that lung cancer screening has become more prevalent, to try and find these earlier is, one of the big areas that we've seen that can improve survival. Like I said, even just that one study alone showed a 20% improved, survival rate. So, that more awareness, I think obviously trying to put that out there, not only in the community, but to providers as well. Primary care physicians, obviously, you look at screening, most people nowadays will, when they go to their primary care physician, when they meet certain age requirements, they're going to get mammograms to screen for breast cancer. They're going to get a colonoscopy or, some other testing to screen for colon cancer, maybe PSAs for prostate. These high rates of cancer in the community, these are already being screened, and, it's just common practice. For lung cancer, that really hasn't been the case, even 5 years ago or before. And so, with this, it's really an area of awareness to try and improve that rate of screening. And I think that really improves survival when we talk about. The other things are technologies that we have to treat lung cancer. And, at Orlando Health, we, for surgery, the vast majority probably over 99% of the surgeries we do for lung cancer to treat lung cancer are done robotically. And, I mean, that's a big advancement that has come around that, has allowed us to be able to offer surgery for patients with smaller incisions than traditional methods. Even around the country, robotics is not the majority of the way that it's treated when we talk about surgery. Still, I think the majority of people around the country are still doing, larger incisions to get this out, and that's really a big area that we, can improve not only the patient's outcomes, but their pain after surgery, their time in the hospital after surgery. The majority of our patients that have surgery for lung cancer are only in the hospital for 1 or 2 days. And I mean, that's come a long way since, my dad even practiced, and operated on people for lung cancer. And so, I mean, that's a big difference, in getting those patients through surgery to treat this lung cancer. And, I mean, you look at when we talk about survival, there's studies that have been looked at to show that, even robotic surgery can be better than some of the other minimally invasive techniques. When you look at, we talk about surgery for lung cancer, we take out that part of the lung, but also, there are lymph nodes in the chest that we remove at the time of surgery to properly stage patients. And that helps us to determine, do they need any other treatment after surgery? And that can help to improve survival there. Because if we are able to find those lymph nodes that may have small amounts of cancer that you otherwise wouldn't know about, that can offer that other treatment, oftentimes chemotherapy or immunotherapy afterwards, and that can improve survival on top of finding things early. So I think those are some of the bigger advancements as far as early treatment and early diagnosis. And then there are other treatment options that have come around in the last few years from a systemic standpoint, for the whole body, including immunotherapy, that are more targeted agents for some of the cancers that we can find. There's a lot of research being done on that, and different tumor markers or genetic markers that we find in the tumors themselves that we can use this newer targeted therapies to help either stop the spread or kill the cancer and improve survival rates there. I think those are the biggest issues that we've found that have helped us out.
That's fantastic. And it is incredible to see just how far treatment has come along to help improve those outcomes for our patients. Now, I want to jump to something that's a new element in this State of Lung Cancer report, and that's really looking at people of color and their access to getting the right kind of treatment, being able to be screened. So I want to talk a little bit about how Orlando Health and how the medical community is really addressing this. And to kind of frame it, one of the pieces of information that had really jumped out at me with health disparities. So the Lung Association, of course, believes that everybody has an opportunity to lead a full and healthy life. And I know you all share the same values. But sadly, there are systemic issues that contribute to health disparities, including people who are facing lung cancer. And this report found that people of color who are diagnosed with lung cancer face worse outcomes compared to white Americans and are less likely to be diagnosed early, less likely to receive surgical treatment, and actually even probably the scariest, more likely to receive no treatment at all. And the report found that in Florida, Black Americans are least likely to receive surgical treatment for lung cancer. So if we can talk frankly about, what are you all doing in the medical community? What is Orlando Health doing to help address this disparity that unfortunately exists here in Central Florida?
Well, I agree. I mean, that's definitely an area of concern. When we look at the disparity, like you mentioned, there's several studies and research that's been done to try and find out, where is that gap? Why is that gap there? Why are we, not addressing those patients' needs? And, I mean, the biggest issues that we've seen, at least in some of the research that's been done, is, the lower socioeconomic status, but also like you said, I think access to care is an issue. And, either whether it's, not having insurance or, not getting to where they need to be, and I think the biggest thing that we can do to help with that, and what we're, trying to do, is obviously improve awareness, and, focus on that, try and improve the importance and focus on the importance of, accessing medical care, making that a priority for, patients in general, especially disparities that they have in the medical community. And, that's the area, that we need to address, is really focusing on the importance of treatment, awareness that, this obviously exists, an area of, risk from a medical standpoint that needs to be addressed, and, just get the word out to say, this is something that obviously can be dealt with, can be treated, we can help with, and then, beyond that, the access to care, being the other issue, other than just awareness. And, as far as access to care, I think, insurance is a big standpoint, whether it's, like I said, lack of insurance or lack of finances to afford insurance, whatever the case may be, the goal is to look at, making insurance more available and affordable. I mean, I think that obviously comes from kind of a governmental standpoint, trying to talk to, work on that care to have better access. But then also from, just a hospital standpoint of improving, the access to care, having availability for patients. I mean, we see, all patients, no matter what their really insurance status is, at the, cancer center, whatever type of insurance they have or not, that's always, something that we try and make available. Other areas, other means, financial counseling to help with the cost, offset the cost of medical care, in patients that need that. That's a service we have to try and work through that. Even patients with Medicaid, we see, try and get, patients with Medicaid in to be seen. And, those are the biggest areas, that we have to focus on, and, improve the quality of care. I mean, when we obviously, most of the time when myself and my partners, I mean, most of us, we don't even know what kind of insurance patients have. It's we're there to treat the problem and help them through this situation that they're going through. And, that obviously is our goal, regardless of anything else. It's just there to treat. And I think, allowing people to know, that's what we're there for, and, we obviously help out in any other way we can to get across those barriers. We make, care available to the patients. And I think really sitting down, when we meet patients, taking the time to sit down and talk about the problems they're having from a medical standpoint or any other standpoint, and what we can do to address those, and really stressing the importance of, appropriate care and, timely care. Also, I mean, we, try and get patients in as fast as possible. And when we do see someone, I mean, we expect to have treatment taken care of, within 30 days of seeing those patients, including the workup that needs to be done to get to treatment. So, that's really the main focus, is, timely, efficient care, manner.
Absolutely. And I think one thing that really stood out to me in what you were saying too is, as a physician, I don't know what kind of insurance you have. I'm literally just here to treat you and focus on you. And that's powerful. So thank you for sharing that. I'm going to throw a little bit of a curveball question to you. Going back to screenings, this comes up a lot as far as questions that we get at the Lung Association, and so many people who come to us through our Lung Force campaign, which is raising awareness for women's lung health and lung cancer. We know we've seen an alarming rise in the amount of women who are diagnosed with lung cancer and women who don't fit the traditional screening criteria of having a smoking pack history, being below that age threshold. What kind of advice would you give to not only women, men too, but people who, have whether it's a suspicion, a family history? We know radon is also a potential cause for lung cancer. What kind of advice do you give for people who are maybe outside of those parameters in advocating for potential screening or having a conversation with their doctor?
So, I mean, I think that's an important fact. Obviously, a lot of people that have lung cancer don't fit into those criteria, like you mentioned. And, that's becoming an increasing trend that we see, is even in completely non-smokers, there's more and more that are showing up with lung cancer. And, it's yet to be determined, why that is, and, what are the true causes of that, whether it's genetic or environmental. We don't have the best answer yet. But I agree. Somebody that's concerned, suspicious, family history, can play a part, and especially exposure. Those are risk factors. When we talk about lung cancer screening, the big thing, obviously, the area with lung cancer screening, the people that fit in the criteria, they basically, Medicare will cover the cost of screening. And so, that's a helpful area for access to care. But obviously, like I said, not all those patients may have Medicare or fit into the guidelines, and so they may not be able to do that. Now, with our lung cancer screening program, patients can log on to go to the Orlando Health website for lung cancer screening and request information, request an appointment or visit, or even look at getting a scan. And that's something that they can do without meeting that criteria or seeing their doctor themselves sometimes, because we want that availability to the patients, to have whether it's they meet the criteria or they've had something else. And that oh, am I still there?
Yes, you're good. Keep going.
Okay. Sorry, I got an alert. So we want those patients to have the access. Now, the patients that don't fit into that criteria, then it's not necessarily covered by Medicare. It depends on what the reasoning for getting the scan would be at that point, based on the provider, whoever's ordering it, whether it's a primary care physician, a pulmonologist, or if they even come to see one of us in thoracic surgery, and need a scan. And so that really, I think if there's concern and they have a history, or they have a history of exposure or anything in their family, those are areas that I think just people need to be upfront, and I wouldn't hesitate. I would talk to your doctor, and they may have other risk factors or other findings or something may warrant getting a scan too, and that can be the difference between finding something or finding something early or finding something late. And I think that I would not hesitate to at least have that conversation and talk to your doctor, whoever it may be. Like I said, whether it's a primary care or a pulmonologist, anybody really can get you in the door and find the right place to go to look at this. And CT scans we know are better than X-rays at looking at the actual occurrence of lung cancer. But I mean, even if there's concern, I mean, even if doing an X-ray may lead to something, so one way or the other, I think just having that conversation, if you have that concern, just like anything else, I mean, if you have a concern about something, you found on your skin, you talk to your dermatologist, or, you found a lump in your breast and it may not be cancer, but, you're gonna, if you have that concern, I would just stress the importance of speaking up about it and, just at least mentioning it and talking about it. And you know, if the concern is addressed, I would either recommend, bringing it up again or talking to someone else about it, or like I said, I mean, we have lung cancer screening available also, just straight to patients. And so, that's a resource that we can offer as well. We can have that discussion with patients and, see if, it's warranted or something we can do to look into that further.
Thank you so much for answering that curveball of a question, but an important one. And, I think we've covered a lot of ground in what the state of lung cancer talks about. We've talked about surgical treatment options, different other treatment options, screening. Is there any other closing thoughts that you have related to the state of lung cancer report?
Well, I think one thing that we see with patients, obviously smoking plays a big part, in lung cancer. We know it's one of the highest risk factors, and that's why, it's a big part of the screening criteria. And smoking cessation obviously is a big, important area, a topic of concern. And I mean, I think when we look at that, we talk about patients with lung cancer, or patients with lung nodules, or, screening, who's getting screened. We know there's a lot of other people that fit the criteria that aren't getting screened, and why. The big question that we have is, why is that? Why are there all these people that aren't getting screened that could? And I mean, I think it's multiple factors that we can try and address. One is, like I said, awareness, whether it's in the community or from the providers that see these patients. Another thing is, I mean, I know some patients that, they smoke, and, either they've tried to quit and it hasn't worked, they've quit and they started back, or they just don't want to quit. And, they've been doing it their whole life, and, it's just, that's what they do, and they may not want to quit. And I think, we all know that, smoking is bad for you. Smoking causes cancer, not only cancer, but other cancers. And so, I mean, I think that's a big area of focus too. I mean, it's continued. I mean, it's definitely improved, but I mean, we still have a long way to go as far as, awareness for smoking cessation. We also have a smoking cessation clinic that, can help patients, whether it's ones that are interested in quitting but don't know where to start, ones that have tried and failed, or ones that have quit and restarted. I mean, that's an area that we can focus on, because we know that quitting smoking, even today, decreases your risk of lung cancer in the future. And so it's never too late to stop. And that's one of the things that we try and emphasize with patients, obviously, when we see them, especially if they're still smoking. I mean, even if some patients I've had say, well, I already have lung cancer, so what's the point in stopping now? If we can treat it and you stop smoking, your risk of getting another lung cancer decreases. So there's always a reason, and that's one thing that we want to emphasize. So I mean, that's one of the areas that we want to look at and focus on. One other topic that I just would mention is, we have patients, obviously with screening, you're going to find things that are not cancer. And I think there's a big apprehension with some patients, to get screened, because they're worried about what you may find. They're worried about, having lung cancer, or, I get stories from patients all the time who come in and say, well, I knew somebody who found something and had a biopsy, and then it spread, and they're worried that if they get a biopsy, it's going to spread, or, all these things, many different scenarios that we see that patients have heard of that know of from their friends or family. And, we try and obviously educate our patients as much as we can to the true risks of what we do and what can happen afterwards. Doing a biopsy, will not necessarily cause anything to spread. And so that's one of the things that is kind of the concern or the stigma of doing the testing, doing the workup. And I think some of the anxiety and stress that goes into that. Patients that have a test and they find something, well, then they're worried it could be cancer. Oftentimes it's not. Sometimes, even if we find something, there's nothing really needs to be done more than just watching it. A lot of things that we find are fairly small. They may have been there for a while, but we kind of just watch it with some scans down the road. And if there's no change or no concerning findings, it may not be nothing to do. But I think that the advantage of finding something early and being able to treat it outweighs the risk of finding something that may not need anything done. And some of the areas we look at, maybe it would lead to more testing, maybe it would lead to a biopsy or something like that. But even some of those may not show cancer. But again, that risk of having cancer and not knowing it, or having cancer and not pursuing treatment, because you're concerned about some other thing that you've heard from somebody else, or the risks that go along. I think the biggest thing is to talk with your doctor, or meet with somebody, if you have that, to go over some of that information and really explain the true risks and benefits of what we're doing and why we're doing it. And so that's one of the areas that we try, is patient education when we see anybody, for lung nodules or lung cancer, is giving them that information to try and not only help you work through it, but set your mind at ease some.
Those are all really fantastic points, and definitely around however you are able to quit smoking, if you do have the habit, is so important. There are so many resources in our community that are free or low cost. There's always the American Lung Association's Freedom from Smoking program, as well as now our vaping related programs, which is a whole nother bag of issues that we'll save for a whole nother day. We'll have to invite you back for that one.
Of course.
But thank you so much for taking the time out of your day today to talk about the state of lung cancer and offering your expertise. If you would like to read more about the state of lung cancer, visit lung.org/SOLC. Thank you again, Dr. Johnston, for your time this morning.
Thank you. It's been my pleasure.